Hi, it's Jim from WhiskeyCongress.com. I said in the last episode that I would talk a little bit about healthcare without boring the hell out of everybody. So I want to talk a little bit about single payer and what it is, what it isn't. And again, if you know what it is or aren't interested, that's what I'm going to talk about. So know that now, and please come back for our next video on YouTube or iTunes or wherever else you're watching this. Anyway, single payer system, as it's being talked about right now, is just about what it sounds like. It is a single entity, in this case we're talking about the federal government, collects taxes and then uses those taxes to pay for health care. That is regardless of income, regardless of social status, and it is regulated. So what you can get and can't get is controlled to a degree. You don't want people getting plastic surgery on government subsidized healthcare, but you do want people to get the kind of healthcare that doesn't get provided enough, and that's preventative care. So if we had more people going to doctors on a regular basis, getting checked, catching things early, not using the ER for everything, which is unfortunately what happens for people who don't have money. And by the way, then we as a society end up paying for that bill. If we had that, things would be better. Now, those who are opposed to single payer will say it's rationed healthcare. That's kind of a bullshit argument. It doesn't mean it couldn't happen that way, but that's why you have a well-written law. So what the law should do is define what you can do, what you can't do, and again, it should be all healthcare based, not cosmetic, not elective. And there should be a system to make it work very efficiently and effectively. It can be done. It is done in other parts of the world. We are the only country in the world that is modern and does not have some kind of government health care. If you ask me, we should treat healthcare as a right of being a citizen of this great country and not an economically driven privilege. And there's a bunch of reasons why the economics actually work out better with a single payer system. There's a lot less administration. There's a lot less negotiation between recovered sums by insurance companies and healthcare providers. Most healthcare providers, I think, would welcome the simplicity. Now, there are lots of people, including people in healthcare, who are afraid of government-run things. A lot of that has been fueled by rhetoric, and one of the things we need to do is stop the rhetoric and start being real. That kind of system can work. It can be abused. If we put a system in place that made healthcare providers not abuse the system by prescribing or instructing people to take services that they don't need, and did encourage them to focus on the healthcare of patients first. And again, patients would need to not abuse the system and not abuse themselves in the hopes that, well, now I've got healthcare, everything will be fine. We do need to as a country, do a better job of taking care of ourselves, and a single-payer system executed properly can make that much more practical. Now, first of all, again, this is Jim from Whiskey Congress. I'm actually drinking red wine tonight. Don't tell anybody. But the scare tactic that will result in rationing of healthcare is brought to you by the same people who said Obamacare had death panels. We've had Obamacare for, 5 years now? I haven't seen a death panel. I actually know a personal story. A woman who was in her upper 70s broke her hip. She was in very bad health, but with a broken hip, her life was miserable. She was on Medicare, and she got her hip replaced. She lived a couple more years, and while those years weren't great, they were a lot better with the mobility that came from not having a broken hip, not to mention the lack of agonizing pain. So for all those people who say that the government system will abuse citizens, this was a not particularly wealthy woman on Medicare who needed a very expensive procedure and got it. And as a result, the end of her life was much more comfortable. So I've seen the system work as Medicare, which essentially, if we had a single payer system, Medicare would be the policy for everyone. When you break it down, it's a little bit silly that we either have government programs or employer-based health insurance because why should who employs you impact how your health care is handled? Think about it. I recently changed jobs. I went from being with a company that provided great health care to being self-employed, trying to launch this. So I had to insure myself. And the complications that came from doing that were pretty frustrating. With a single payer system, wouldn't have been a problem at all. In fact, who was employing me would not have impacted how I received health care. The truth of the matter is, I need some dental work done. Because I changed jobs when I did, or left the job when I did, I had to get new insurance, and they won't cover the very painful tooth I've got for a month. I understand why insurance companies do this. When you think about it, an insurance company is basically trying to bet money against your healthcare risk. If you're worried about how the government will treat you when it comes to deciding between money, think about how a corporation will treat you, because they are dependent on meeting a bottom line. Frankly, folks, there's certain things that should not be for profit. Providing healthcare is one of them, in my opinion. And please don't spin this. Another thing that drives me nuts is when people say, well, doctors need to get paid well. Damn right they do. And this has nothing to do with that. Doctors still get paid well. In fact, in most cases, I think, with the exceptions of ones that are in more affluent areas, doctors could provide services to people knowing that they would be paid for their services and to know what they would get paid. And there's a lot more I can say about that, but I'm going to stop there. Hope you've enjoyed my little rant about single payer. And there'll be more coming. So if there's any topics you want me to discuss on healthcare or anything else, email me at jim@whiskeycongress.com. And again, please follow us at whiskeycongress.com on the social media things. Follow us. Please give us a review on YouTube and on iTunes. And thanks for listening to my rant. More to come. Bye.